Good afternoon, and welcome to your weekly edition of CommuniTEA,
Unity.
hosted by your Houston branch NAACP. How you doing, Portia?
Oh, I'm fabulous, Miss July. How are you doing?
I'm great. I am enjoying the last few days of my vacation. My
Yeah, I
much
know.
needed
I'm
vacation.
jealous over here. I really wish that I could be out there, just lounging with you, girl. But
That's because that's
gotta
all
get
I'm
work
doing. I'm not
done.
going nowhere. I'm resting. Well,
One
this
day.
this week we have a really good show produced by Nichelle, and I'm really excited about it. It's an issue that affects all of us pretty much. And I know that our guests, we have a dynamic panel of guests. I know they're really going to bring forth a lot of great information. But before we bring them with all their great information, Portia, tell us, what are our announcements?
Okay, so first and foremost, we are powered by membership. We're a membership-based organization powered through our volunteers. So as always, I have to plug our membership. So if you are not currently a member of the NAACP Houston branch, we encourage you to join us now. It is $30 for 1 year. So if you join today on August 5th, 2020, you'll be a member until August 5th of 2021. And that's just $30. Or if you want to have a deeper, more longer lasting relationship with our organization, and you just come into our family fully, you can become a life member. The subscribing life membership starts at $750, but don't be worried. You don't have to pay that all at once. You can pay that in installments over 10 years. So we would love to have you join our family here at the Houston branch. You can visit our website. It's going across the ticker right now, naacphouston.org. Or if you happen to not be in Houston and you want to join wherever you are in the United States, you can visit our national website at naacp.org and join now. And while you are there at our national website, there's so many good things going on at a national level with our association. So first and foremost, right now we have the Arts, Culture, and Entertainment Festival going on. It's going on for one more day. That's pre-screenings of like a lot of movies that are getting ready to hit, really Prime Video at this point, because nothing's going into the theaters. Some shows that are getting ready to roll out on Hulu and some of the network television shows. So go ahead and check that out. Go there now. There's still a couple showings for this evening, and then tomorrow is the last day. So go to our national website and click on that link, or you can go to naacp.org/ACE festival-2020, and that is going on now. Also, something else that the Arts and Culture and Entertainment Festival is doing, they just posted this. They are doing a video submission contest. If you can sing, y'all, we got our singers out here. You can sing, you can submit a video of yourself singing Lift Every Voice and Sing, and you'll be entered into a contest, and that has to do with the Image Award. So I definitely encourage you to go check that out at our national website as well. We have the March on Washington, the virtual March on Washington, happening in a few weeks, August 27th and 28th, and that's going to commemorate the 57th anniversary of the March on Washington. So, we just lost an icon in John Lewis, and that's all about representing him. We lost two icons. We lost C.T. Vivian and John Lewis, but we all know that John Lewis gave that, gave a keynote at the March on Washington. So we want to recognize him and pay homage to him in that. And you can go visit March 2020, and that is the website for that. So 2020march.com, 2020march.com, and you can go sign up now to be a part of that event on August 27th and 28th. So the National Convention, one last thing for National, the National Convention is going to take place on September 13th through the 26th, and that's going to be virtual. So you can visit naacpconvention.org to find out more information about our convention and when that's going to be convening and all the things that are going to happen there. On a local level, so we want to shout out our Houston City Council for doing some amazing things to help our community. So just today, they announced that they approved a $20 million fund for renters in assistance. So make sure, that's posted on our website now. We encourage you to go check that out and see how you qualify. But that's awesome. We know that the national moratorium just lifted on evictions. So our people, everybody needs this assistance right now. So definitely go check that out. The Houston City Council with that $20 million fund for renters assistance. Additionally, the Houston City Council also put $15 million into a fund for small business economic relief. So that is also live right now. You can go check out, you can go to the Houston City website. So if you want to go to tx.gov, and you can find out the information about that that fund as well. So that's $15 million and $20 million. That's like $35 million in funds and relief aid for the city of Houston. So please go take advantage of both of those opportunities. I will try to post those links to both of those things in our comments. And before we go forward, we are in the middle of a pandemic, so we are not going to go through any episodes of this show without calling attention to COVID. So the branch is doing some amazing things in the community and making sure that our community is taken care of, and partnering with the Cure COVID Consortium to do free COVID testing around the city, and we're partnering with faith-based organizations. So we are going to be at Harvest Time Ministries, Harvest Time Church on this Saturday, August 8th from 9 to 1. And that church is located at 17770 Imperial Valley Drive over in Greenspoint. So if you're in that community, make sure that you check that out, or you go and get tested for free from 9 to 1. You have to pre-register, so you want to make sure that you're registered ahead of time. And so you can visit curecovidconsortium.org, and you can sign up ahead of time. And they're going to ask you some questions before you just are cleared to be tested. But we want to make sure that you do that. And that's a partnership that we have with the Cure COVID Consortium, with Bay Good Foundation, with Start Small, and then also Bread of Life Foundation as well. So we want to make sure that, we're taken care of. And then one other thing, on our branch website right now, we have a COVID tracker that's actually available. If you go to naacphouston.org and you check out, you kind of scroll to the bottom, and there's actually a live tracker on there that will show you where the COVID, spikes are. So if you're going somewhere or you have family in the community, make sure that you are checking that out so you can let them know if there's an outbreak in their community. So we're trying to stay ahead of the ball game as much as we can and make sure our community is taken care of. So we just encourage you to do that. And then one last thing, we know that it's election season. It's a platform that we are spearheading here at the local level, and of course at the national level, that's filtering down. So we're all about our Get Out the Vote efforts, all about getting people registered to vote, all about helping people become people that can register other people to vote. So we encourage you to become a volunteer voter deputy here in Harris County, or if you're in Fort Bend County, or in Brazoria County, Montgomery County, any of our surrounding counties. We encourage you to become a volunteer voter deputy registrar and be able to help us get out the vote. We're going to start hitting the ground here shortly this month, in the next couple of weeks, to start doing some more voter registration. So we need our Army, we need our soldiers with us to be able to get people registered to vote. So make sure you check that out, and we'll provide more information as we have more available to you. But just as always, check our branch website, check our branch social media, so Facebook and Instagram, and then also you can check out our young adult page as well, and we post all the information about the branch there as well. So thank you. I know that was a lot. I'll drop some links in the comments, but I just wanted to make sure we got all that out before we get into this amazing conversation about health disparities, and we know sometimes it goes a little long, so I wanted to make sure y'all had all the information up front.
Excellent. Thank you so much, Portia, for that information. And I just want to mention, you brought up Congressman John Lewis, and I mentioned CT Vivian, but a lot of people have benefited from CT Vivian and don't really know who he is. And I just want to make sure people take the time to understand what a CT Vivian meant to the movement and to our communities across the nation. And as Portia mentioned, he's the founder of Upward Bound. I was not an Upward Bound student, but I was an Upward Bound employee for many summers. And I believe it touched my life just as much as it did the students who had the opportunity and privilege to go through those programs. Many of those alumni, they're leaders in our communities today, people who've gone through Upward Bound. So just want to make sure we honor our ancestors, those who have gone before us. All right, Portia, we'll catch you in a little bit. I'm going to bring Michelle in so we can get this party started. Thank you. Hi, Michelle.
Hi.
Hi. So thank you very much for producing this excellent episode. I'm already calling it excellent because I'm aware of your passion as well as the information that's going to be shared today. So, real quick before we bring in the first guest, maybe 30 seconds, tell us why you wanted to do this show.
I really want to do this show because I feel like this is a topic I'm passionate about as somebody going to listen, and I think that everyone should have equal access, and honestly, that everyone should be able to get equal health care and have health disparities, specifically within the Black community and Black women. And I think talking about it and bringing awareness to this issue is going to be able to help us like level out those disparities.
Okay. Well, excellent. Well, I know you've put a lot of work into this. So without further delay, I'll bring in our first guest, Dr. Taria Richmond, MD. Hi,
Hello.
Doc.
Hi.
How are you?
I'm well. How are you all?
We're good. We're good. Nichelle, let's go. It's your show.
Okay, so the first question that I had for you, I just want to say thank you again for coming. What should women ask prior to giving labor?
I think she froze a little bit.
Am I frozen?
No, Nichelle froze a little bit.
Okay, I was like, am I frozen? Yeah, I think I heard you. I think I heard you. Okay, you said, what should women ask before labor, or what should they do?
Yes.
Okay, so certainly I want to introduce myself a little bit. My name is Dr. Taria Richmond, and I am a family medicine physician in private practice in Third Ward. About 95% of my patients are women, and from all life cycles from 13 up to my oldest patient is 91. And so I certainly see patients in their reproductive years. And so when you're pregnant and you're expecting to deliver, before you go into labor, you want to make sure that you are getting adequate prenatal care. So as soon as you know that you're pregnant and you want to have a baby, you want to make sure that you make an appointment with your OB-GYN or have your primary care doctor refer you to an OB-GYN. And as far as labor is concerned, you want to ask questions like, where am I delivering? Can I have a tour of the location? Who's going to be delivering me? Is it going to be my OB-GYN that I've been seeing this entire time? Is it going to be a different doctor? If there are complications, what if I don't want to have a C-section? Or what if I don't want to have a epidural? What are my options? And so that's what you really want to know, what your options are before you go into labor. So you want to start prenatal care as early as possible, because we know that has been shown to improve delivery outcomes.
Right.
Excellent.
I like that one of the things you brought up was about one of the topics was the C-sections, because I know Jules brought it to my attention today about that. It seems that Black women are seeming to be pushed more to get C-sections, even though they cost a lot more money, and we know what is it for them.
Okay, she froze. Could you say that last part again, Nichelle?
What was the reason that women were being pushed more, especially Black women, pushed more to have C-sections?
So we're hearing about racism. We're hearing about bias when it comes to Black women and when we deliver our babies, and in general. So there's some biases that doctors who may not understand us, culturally may not have the ability to communicate with us in a way that we understand that, okay, so if something is happening, we're thinking of going to take you for a C-section, and these are the reasons why. And sometimes it is the baby's heart rate is dropping, the mom's blood pressure is going up, and that's a risk for a seizure. And so the tolerance to kind of let a woman labor down, and I'm excited y'all have doulas coming on to talk about that. But actually let a woman labor down and go through the natural process, it just depends on the doctor's tolerance for it. So they're really concerned about the mom's safety and the baby's safety. But there is also some innate bias when it comes to Black women in our healthcare and maternity and our deliveries.
Oh,
Thank
wow.
you.
Yeah.
Do you have a question?
No, I was just, the reason why I shared that with Nisha, I saw the cost difference. So like the United States, I saw a graphic just last night demonstrating the cost for childbirth around the world in developed countries, and the United States leads the way. And we track, I think it's like a $5,000 difference between traditional natural childbirth versus a C-section. And a C-section is considered a surgery.
Correct.
Okay.
Now, Jules, you're trying to get it started.
So disclaimer, I'm political science professor, so it's in my nature. So bring it out. Let's talk about it a little bit.
Yeah, no, so you certainly, I certainly don't want to say that my colleagues are taking women to surgery or Black women to surgery so that they can make more money. In essence, that's the question, right? Because a C-section, while it is a surgery, is still very dangerous. It's very dangerous for the mom. It's dangerous for the baby, and there's a lot of liability that comes with that from the doctor. So I definitely hear what you're saying, and I can see where that makes sense. But there's still a lot of liability that I don't think doctors want to necessarily take that liability and take a patient into surgery to make extra money. It's not everybody. That's why you have to have trusted doctors, right? Yeah, you have to have trusted doctors, and you have to be able to advocate for yourself with that doctor. If you are not comfortable talking to him or her when you've asked questions previously and you don't feel like you've gotten an appropriate answer or you feel comfortable with, then it's time to find someone different.
Yeah, I find that in our community, even when you look at legal issues, we look at attorneys, doctors, and other professionals from a standpoint of authority oftentimes. So oftentimes people, they feel like they have to go along with what that person is telling them instead of thinking, well, it's still me, it's still my body, right? It's still my it's still my freedom. Like if I say I'm not guilty, I'm not taking a plea. It's that type of thing. Yes. Same thing in healthcare. And so what are some things that patients should be talking to? Because we're sharing this with a lot of people. So some things they should consider in conversations with their physicians, not just their OBGYN, but just physicians in general, to understand their bedside manner.
Yes, absolutely. So some of the things that you can do when you're going for your doctor's visit is, one, be informed. We do talk about, Google doctor and we go online and we look up all these different things, but that also empowers you, right, to understand, okay, if I'm having a stomach ache, well, it could be this, or this. And when I go to the doctor, I can have a conversation about what it is that I'm feeling and what I've learned about that situation. Go with questions. Have your questions written down in advance, and that way when you get there, it's not, because it can be that dynamic where there's the authority here and the patient here, and we know that in our community, in the Black community, is even, especially if you don't have a Black doctor, is even further apart, right? For whatever reason, we respect, and it's a whole nother conversation, white male doctors a lot more than our own doctors. So go with your questions. And then if you don't feel like you're getting the appropriate answers, then you can schedule and make another appointment, or, obviously see someone else. And if you leave and you don't feel satisfied, you don't feel heard, you certainly can voice that, and you certainly can let the office know.
Okay. Michelle?
I mean, that was the question I had next, was the best ways to advocate for yourself, because I know a lot of people, Black people feel unheard when they go to the doctor's office because they give their concerns, and then the doctor kind of not downplays, but they kind of doubt what the person is saying. And I think that also in turn leads to a lot of people doing the online doctor thing, like, okay, well, this is how I feel, going with that. So
yeah. So we know that racial bias is real, right? we know that we everyone has innate bias, right? But particularly in the medical community, they checked in with medical trainees, and over 50% of them did not believe that Black people experience pain, that our skin is thicker, and that our nerve endings are not as sensitive as white people. And this goes back years and years and years and years. And so that brings in, what do we need to do on the provider side to get us to do more culturally competent care? And then from the patient side to know, okay, just start taking in, like watching what the doctor is saying, kind of getting a feel for them, and just saying, okay, well, it was nice to meet you, but I have a choice, right? Because either you're paying insurance, or you're paying cash, or you're paying credit. The patient is the customer.
Right.
So, but it goes back a long way, and we're really working hard to get that changed. And I heard y'all talking earlier about voting. So, Kamala she is up there advocating. So it's so important. We could talk about, how to do this one-on-one with the doctor. But another way to manage this is, when you vote, and that it trickles all the way down to your doctor's visit. And I think a lot of people don't know that.
Right. It's interesting that you brought up Senator Harris, because I just sent that article last night about the new legislation that she's pushing up in DC. I'm pulling it up now.
Is it the Maternal
regarding
Cares
uterine
Act?
Fibroids.
Oh, she did. So she's doing two. So she's done the Maternal Cares Act, and then recently trying to get more advocacy and research funding for fibroids.
Right. So we hear about fibroids a lot. Like, I've had conversations with people, and they're shocked that I don't have them. Like, well, it's not like all of us have them. Right. And that's been a thing that I question, like, why so many Black women have fibroids? Do they really have them, or are they being identified as having them? Right. That's just me doubting sometimes, right? Because I was literally in a circle of like 6 women. I was the only one that didn't have that issue. And I was like, do I need to knock on wood or what? So could you talk to us a little bit about uterine fibroids and how that affects us when it comes to pregnancy, getting pregnant, staying pregnant, and all of that?
So let's talk about fibroids. So fibroids are non-cancerous growths on the uterus, and actually we're able to see those on ultrasound. So it's not that you go in and a doctor looks you from head to toe and say, oh, you have fibroids. But if you get your woman's examination, when we do the pap smear and then we do the manual examination, we can actually feel if there's masses on your uterus. You'll feel like you're 12 weeks pregnant when you're actually not pregnant. And so that is the first clue for us on a physical examination, aside from your symptoms, that something is happening with your uterus. So to confirm that, we do an ultrasound. And we do an ultrasound on the top of your belly, and then we do an ultrasound where we actually insert the probe in the vagina and take a look. So we can actually see the fibroids. And we don't know why Black women are more likely to have fibroids than our white, Asian, Latina population or counterparts. So we don't have the real answer for that. And part of the reason why we don't have the real answer for that is because we don't have as much research, because we don't want to participate in research. So It's hard to get more answers because we don't want to be a part of the research.
And that's because of the historic tendencies for us not being listened to, or our bodies being used.
Exactly.
Yeah. Okay.
Exactly. Yeah. So we're working on the.
Go ahead, Doc.
Oh, no, that's okay. I was starting to look here.
Okay. So we have a comment. I'm going to bring it to the screen. Jessica Davison Jefferson said, traditionally, can you bring doulas to all of your doc appointments as an advocate? And of course, outside of COVID.
You absolutely can. You can bring who you want in your appointment. You can bring them with you. So that's a conversation to have with the doctor, especially if you want your doula to be not only in your appointments with you, but also at the bedside, or however you decide to do your delivery. You want to talk to your midwife, your doctor about if that's set up like that, if it's okay, and if it's not, then of course you need to find another provider who will be okay with you having your doula with you.
Okay. All right. Thank you so much. Take that away. Nichelle, did you have another question for the doctor?
No, that was pretty much it.
All right.
So I saw they asked about more statistics. Someone's asking about more statistics. So let me just share a few. It's unfortunate, and we have a whole lot of work to do. But Black women are 4 to 5 times more likely to die in childbirth than their white counterparts. And that doesn't matter your socioeconomic status. It doesn't matter your education. We look at what happened with Serena Williams, and she had blood clots. So cardiovascular having high blood pressure, throwing blood clots into the lungs puts us at a higher risk of maternal death. But the flip side of that is either it's preventable, or if it was diagnosed earlier, then it could be treated and it wouldn't be such awful outcomes.
Okay. Oh, wow. Well, thank you so much, Doc, for joining us today. So I just want to make sure I got this right. So you do family medicine?
I do. So I do family medicine. I was trained at Baylor, so I do everything from the head to the toe, total body. So if you need your woman examination, if you have anxiety, depression, I'll start to refer you to the therapist or start treatment. So I do everything. Your physicals, chronic disease prevention. If you're pregnant, I will start help you with your pregnancy in the beginning of the pregnancy and find you a qualified OB in my kind of circle of OB friends. So I do it all. I call myself a one-stop shop, and I'm in Third Ward, South Park area.
Okay, excellent. Well, we do appreciate having you here today. We're going to do more around this conversation, especially when outside opens up. We want to get back to doing forums and town halls, really bringing the information and our own experts directly to the community. So we do thank you for taking the time today. And on a
Please have me back.
Yes. I thank you. And I'll look at that other legislation by what was that act?
It's the Maternal Cares Act.
The Maternal Cares Act by Senator Harris.
Yes.
All right. Well, thank you so much, Dr. Richmond.
All right. Thank you all. Have a good day.
You too.
Okay. Bye.
Bye. All right, Nichelle, how you feeling?
I feel good. That was awesome.
That was awesome. Great. I know I saw Representative Theory come in, and I think she jumped out. So we'll wait for her to come back in if you want to shoot them a text message or something. Sure. And Portia, I'm going to come to you while we wait on Representative Theory. Did you have additional announcements?
You know what? I can share a little bit more. We have our free legal expungement, stealing and more clinic that goes on. So normally when, like July says, when outside is open, we host a monthly free legal clinic at the branch. So that's kind of been tabled, but they are still doing, some services. So if you reach out to our legal redress, Mary King, she was watching earlier, and she can assist you or direct you to whoever you need to reach out to. So if you can email legalredress@naacphouston.org, and they'll try to help you with circumstances or try to get you with the help that you need. So if you need any legal help, legal assistance, it's something that we normally do, just a little bit, modified now during the COVID pandemic. So also, we are doing our Freedom Fund this year, of course, as our annual fundraiser, the biggest fundraiser for every NAACP branch across the country. We're going to be doing it virtual this year. So I know all of us go to the luncheons and the banquets and stuff that we typically go to every year are shifting to a virtual platform. So ours will also be virtual on October 23rd of this year. It's the second to last Friday of October. So you can visit our website, naacphouston.org, and check out the information that's listed there if you want to be a part. Of course, we're powered through members, powered through volunteers. So we're a nonprofit organization, so we need your donations as well to keep our operation running. So that is the way that you can contribute. Or if you ever just want to donate to our branch, just, if it's on your heart to give, we also take those donations, and you can go visit our website right there. And if you ever want to donate to our committee, so we got community coordination and young adult committee on the, rocking and repping for the organization on this platform. So if you ever want to donate to either of our committees, that's young adult or community coordination, you can also to donate, and then just let our executive director know that, you would like your funds allocated to our committees. And then last but certainly not least, y'all, Census 2020. So I don't know if y'all saw the information coming down, but they are trying to cut census off a little bit earlier than it was expected. So we're supposed to go through October. So they are starting to ramp down their efforts at this point. So if you have not submitted your census as of yet, and I know that there are so many people that have not, because in the state of Texas, we're only at 58%, and here in Harris County, we're at, I think, 56%. Harris County is at, 57.6%, and the city of Houston is just at 53%. So we are lagging behind the nation. So we need to get that done, get that information in. It takes you less than 10 minutes to put that information in. July has the link scrolling across the bottom. So please complete your census. It's how we get the funds that we need on a local level, a state level, to do the work that we need to do. It's how we get more money allocated for our schools and for our public services. So please, please, please complete your census.
Thank you so much. I think Representative Theory is having a few technical difficulties, but I know she is going to join us.
And I'm excited to hear her. I had the opportunity to hear her at the Black Women's March, I think maybe in 2017 or 2018, that they organized here. And her story is definitely going to add to the narrative that we're pushing today. Absolutely.
Yeah. Okay. Well, I just wanted to mention, last night was historic. We have a moment here, so do a couple of more current events. Missouri passed Medicaid for all in the state of Missouri. And I think that's exciting, because if they can do it in Missouri, in a show me state, we can do it here in the Lone Star State. We can do it in Texas. But also I want to congratulate.
Looks like we're buffering a little bit, y'all, but that's awesome. I used to live in Missouri.
Oh, we were buffering. Oh, yeah. I want to congratulate Cori Bush for winning her congressional seat. She defeated longtime. He served for 10.
July, I was gonna say, run that back, because we missed it, because I think we lost the connection a little bit. I heard Medicaid for all of Missouri, which is awesome. So I used to live there.
Okay, so can y'all hear me now? Okay, so I was saying they passed Medicare for all in Missouri last night, and I think that's wonderful. What we're seeing across the country, and Missouri showed this last night, people who are in more urban or suburban areas are supporting such legislation. It's people in the rural areas who need it the most, who are literally voting against their own interests. And
because they don't understand, though. Maybe they don't understand.
I don't know if it's that they don't understand, or it could be a way that the information is delivered intentionally to push them from wanting something that works for them. For example, we saw in 2016, the whole thing was get rid of Obamacare. And then people were saying, well, they cut my insurance. Well, you had the Affordable Care Act helping you, but you wanted to label it Obamacare. You didn't you love what was being delivered. You just didn't like who delivered it.
Right. And seeing all the people realize from the top level of government, like, oh wait, my care was cut for my pre-existing conditions, and then it was like, oh, it's not so bad to have this legislation in place. So
right. So that was really big coming out of Missouri last night, and hopefully we can see something like that happen here in Texas. I think we still have
that's
a few more.
surprising in Missouri, honestly.
We
I'm
have,
not gonna lie
a
to
little
you.
bit more time to get it. Don't we have a little bit more time to get propositions on the ballot? When's that deadline?
I believe it's in a couple of weeks. So
okay. I know it's this month to get initiatives and proposals. Excuse me, propositions. I'm so much on vacation. Propositions on the ballot, but nonetheless, it's really good to see that last night. And also good to see Cori Bush gain that victory. If you're not familiar with Cori Bush, she she is a grassroots advocate, activist, whatever you prefer. She works in the community. We saw her rise up during the Ferguson protests. Was that 6 years ago? 2014?
Yeah, 2014. Yep, 6 years. Right before I moved here. I lived in St. Louis when all that went down. So I moved here in 2015. So
yeah. So what we're seeing around the country is we're seeing a shift in leadership. The gentleman that she defeated had served 10 terms in Congress. He's a current congressman. And his father served before him. So combined, the Clays served 51 years in the United States Congress from 1969 until next January, when Cori Bush is to be sworn in. All right. So what I'm going to do is, I know we kind of talked a few minutes. I was trying to give
and I think she's going to be a little bit more delayed. So maybe I can just extend the show.
State Rep Theory a few minutes. I'm going to go ahead and bring the doulas in, and we'll start with them, and then we'll shift gears and put her on the back end, but we'll still spend quite a bit of time with them. Thank you so much, Portia. Hi, ladies.
Hi.
Hi. So I know we have Nichelle. She's on the phone. So as soon as she's free, I'll bring her back in. But thank you so much for joining us. And I do want to apologize to Dr. Richmond. I did not introduce her. It was just, I'm in the mode thinking that I was just ready to go because I'm so excited about this topic. So I do want to apologize, but I do want to make sure that I give you all the opportunity to introduce yourselves. So whoever wants to go first.
Okay, I'll go. Hi, everybody. My name is Tanika Williams. I am a doula here in the Houston area. I am a birth doula and a postpartum doula. I've been doing it for about 3 years. And last year before it was kind of like part-time, but last year I hit the entrepreneur button, and now so I'm doing this full-time. Happy to serve the birthing parents and the birthing families and the community.
All right. And Deshawn?
Yeah, I'm Deshawn Desrosiers, and my business name is Harmonious Birthing. I'm also a birth doula. I do a lot of postpartum work as well. I'm also a student midwife. I'm here in Houston with Senika, so I still have about 2 more years left until I take my exam to become a licensed midwife. And so, yeah, I'm just here doing the work here with Senika as well.
We are so excited that she is a student midwife. Like, I can't wait till can drop student and just say midwife. Like, everybody.
I know, right?
So excited.
So tell us, what is the difference? Oh, I see Nichelle's available now. I'm going to bring her back in. What's the difference between a doula and a midwife?
Well, the difference between a doula and a midwife. So, like, as a doula for like Senika and I, we can't necessarily perform medical tasks. Like, we won't do like cervical exams, pap smears, pelvic exams, and things of that nature. We can't prescribe you anything or anything like that. We can't give you medical advice. So a doula's role is to offer emotional, educational, physical support, things of that nature, and also advocacy. To whereas your midwife, if you go to your midwife's going to do your newborn assessment. They're going to do your your blood draws and do your baby's hearing, and they're going to come over and examine, do pelvic exams and check for dilation and things of that nature. So.
Okay.
I like to say that one doesn't replace the other. You can have a midwife and you can have a doula, and add them both to your birth team.
Right.
All right. So at what point or how does a woman decide that she wants a doula? What do you hear most commonly is a reason why a woman wants to go with a midwife or a doula or both?
So if you're a Black woman, what I'm getting most of the time is that the Black birthing bodies are literally afraid to give birth in the hospital. Most of my clients that are coming to me, doing interviewing me per se, are telling me that's their number one thing, and that's a uncomfortable position to be in, to be pregnant, to be expecting to bring this person into the world, but also scared to do it in the hospital setting. So that's one reason why they're coming, because they want to be informed. They want to know their options. They want to have somebody by their side that's done this before numerous times. I like to say dads are awesome, and dads are, and of course, like a dad is going to look into their spouse's eyes and be like, I love you, you're doing great. But some dads are squeamish and they're not about that blood life. So as a doula, like, this is what we do, right? Like, we live for this. And if a birthing person comes on to us early, we're able to download so much information to them. But we take them as they come. If they come to us 13 weeks, I had a client come to me at 39 weeks. Like, it's at any point that they can come on.
Okay.
Right. So literally everything Tanika said, of course. And it's not necessarily always like, some of our clients can't necessarily afford to do an out-of-hospital birth. So sometimes if they can only have a doula that's going to come with them to the hospital, they do feel more secure with that. And, of course, statistics show that to be true, that you can be more safe, especially for Black women in a hospital. And I also want to get into some other issues that brings us to that point to where Black women feel more safe with a doula or out of hospital birth, whether that be a birthing center birth or a home birth. So first, you literally cannot understand maternal mortality. You can't understand the crisis without first examining literally the infiltration of racism and systemic racism in literally every sector of our society. And that's literally going from healthcare professionals to implicit bias. And we have implicit bias and we have explicit bias. And so implicit bias is when your healthcare professional thinks things about you because of who you are. So right here, we'll just say because we're Black. So they have implicit bias about you just from you walking in the door. Well, explicit bias is when they're acting on that bias. So, no, I'm not going to answer your questions because you're Black. Or, no, I'm not going to tell you don't eat this or don't eat this. Or maybe I'm not going to really tell you that you're anemic. I'm not going to really go over your blood work with you because I don't think that you care because you're Black. That's explicit bias. And that is what leads to preventable deaths. And that's why our numbers are so high. That's why it went from 1 to 3 times to now 4 to 5 times higher or more likely to die than our white counterparts. And it's over 5 times if you're over the age of 30. And it's 6 times if you have if a Black woman has at least a college degree. That makes absolutely no sense. So that's why, yeah, I'm telling you, go on NIH, go to CDC, it's all right there, right in front of your face. And these are preventable deaths. These are all preventable deaths. This is everything from cardiomyopathy, embolism, hypertensive disorders, hemorrhage. So many of these can be prevented.
Right.
Wow. Girl, you got me with that college degree thing, because I would think that social economics would play a role in it. We know that typically if someone does have a degree, they kind of will earn not a lot more, but they'll earn more, or at least have insurance and bit like, okay, you just really
No,
threw
that doesn't even matter. It's all
Right.
wow.
over your skin. As sad
Oh,
as it is, but that's the fact.
oh wow. Okay.
The bottom belt is that you're Black, period. When it comes to maternal mortality and the crisis that we're in right now, it's just you're Black. It doesn't matter if you are Serena Williams, clearly. It doesn't
Right.
matter if you make $2 an hour. If you're Black, you're Black.
But why would it be 6 times more? Like, why would that even? Is it just because that's how they? Maybe that's just the way they approach the study. I don't know.
Possibly. It could also be the intimidation, or maybe like someone who has a college degree will be more apt to, maybe try to advocate for themselves or kind of go back and forth with the healthcare provider. And then that may in turn make a healthcare provider that has implicit bias more anxious to just hurry up and get you out of their office. So,
Oh wow, I can understand that. I could totally get that. Wow, Nichelle, did you have a question?
Yeah, I was wondering also about services you may also offer postpartum for the women that you're working with.
Okay, great question. So some of the services that I offer is I offer lactation support. I don't say I'm like a lactation consultant because that's my title, but I'm a breastfeeding advocate. I breastfed 2 babies for a total of 4 years, and then a significant amount of research for breastfeeding so that I could get through the journey and in turn help breastfeeders and chest feeders do the same. Also offer belly binding. I'm not a nighttime postpartum doula because I have little ones, but postpartum doulas do that, like take over that night shift for you. Sometimes it's some meal prep, some light cleaning. One of my favorite things to do is just reintroduce the birthing person into the world as a parent. Whether you had birthed 1 child or you birthed your 6th child, everything changes every single time. So supporting that birthing person through the new cycle, because a lot of times as soon as the baby's born, everybody's eyes on baby. And I'm so passionate about the birthing person and making sure that they're okay, whether they decide to breastfeed or chest feed or not. Taking care of a little person that can't do anything for themselves is a huge undertaking. And it's so important to me that they're supported and that they're still recognized as a person and not just like such and such mother, such and such parent. So those are some of the things that I offer.
I was going to ask if you could explain what belly binding is.
Yes. So I'm actually going to let Shawnee do that because she does it more.
Yeah, I do belly binding. And so belly binding can come from, every culture has its own aspects or origin of belly binding. So for the sake of us being Black, our belly binding stems from our African origins, but then post-slave trade, we have where we had the origination of granny midwives. So our Black granny midwives would wrap our, the new mom's belly in typically a white sheet because that's what we had available to us. And so, you take the newly postpartum mother and you pretty much, to say the least, bind their belly, wrap it. I don't have someone right here right now, but we pretty much wrap them tightly. And that helps with things like diastasis recti, which is when you have your abdominal walls like this prior to pregnancy, and then they slowly stretch out. And so sometimes you can have is after you have the baby, they stay like this. And that's why a lot of moms, even, year or 2 later, they have kind of like a pudge or they still look a little bit pregnant. It's not because, they have baby weight or baby fat. It's because their abdominal walls are split, and that's what's called diastasis recti. And then it just also just helps keeping that warm. Our ancestors were big on keeping our core warm, eating hot foods postpartum, things of that nature. So you wear it up to 6 weeks. So I'm not sure how long you have your clients wear theirs. Probably just until they feel comfortable. I mean, sometimes I tell,
pretty much.
Some
we'll people like really enjoy it, and it's like,
right.
I'm it up.
Yeah, sometimes we'll say 6 weeks or 40 days, and then I don't feel like wearing this no more. So they don't take it off. But
right, and it supports your back, your lower back, and then also after you have a child, you might have like this falling out feeling. I mean, you've had this baby in for 9 months, and it really just supports all of the extra. I'm gonna call it jiggle because I had it. When it's like, whoa, there's a lot of stuff going on there, but it just gives you some extra support.
Okay, so I have a question or some remarks, and it'll become a question, I'm sure. Many people, and I've had conversations, they really don't understand, and you all have done a wonderful job of explaining the role of a doula and a midwife. But when I think of those, I honestly, you said ancestors, and that's honestly what comes to my mind, is just that village aspect. So you have this group of women supporting this mother and supporting this birth person. I heard you say that a couple of times, and I know language is really important. So I want to make sure I say that instead of just mother. But this birth person, you have them supported. Does that support transfer like when it's a hospital setting, as well as what we see when we see like images or videos from home birth where you have that village, so to speak? Does that also take place, say, in the hospital settings?
Absolutely. When you bring a doula to your team, that's exactly what you're hiring, in a sense, because the reality is you're going to have a doctor. They're going to come in, and they're not going to be with you the whole time. And some people are surprised at that. Like, you might be in labor in the hospital for maybe 16 hours. There's going to be nurses that are on staff. There's going to be kind to you. They're going to be coming in and checking on you and making sure you're okay. But they're not going to be with you the entire time. When you hire a doula, you're hiring someone to be your one-on-one, pretty much, to be your physical support person, your person to remind you of your strength, person to help you navigate uncharted territory. Case in point, if the medical professionals come in and they're like, oh, well, we need to do this. We've already had discussions prior to Labor Day on how you want to navigate that, and what questions you want to ask to understand if you're in a true emergency, so that you can have time to make an informed decision. And the reality is that majority of birthing people are birthing in the hospital. And it's the hospitals that have the statistics. If midwives had the statistics that hospitals had, midwives would be shut down a long time ago. And they're actually always trying to shut midwives down in some way, shape, or form in some states. So that's...
Yeah. I'm going to bring Dr. Richmond back into the conversation real quick. There she is. And I see we have Representative Sean Theory in the studio, so we'll be bringing her in after this segment. But Dr. Let me unmute you. Okay. I wanted to ask you, with your experience with your patients, how often do they request doulas? Is that something you're seeing happening more? And what's that network like between physicians to doulas? If a patient wants to have a doula or a midwife, and what type of education do you offer patients, or what type of questions should patients be asking their physicians in this regard, especially with more and more of us learning about the mortality rates around for Black women when it comes to childbirth?
So thank you for that question. What I would say first is that when a patient is looking for a doctor, that don't choose a doctor and then ask about what they think about doulas, what they think about the process, because you can hit a dead end. What I would say is you look for a doctor like myself that culturally understands what this means to a woman to go through the birthing process. And then even postpartum, it's so many things that happens postpartum, including postpartum depression. It's doctors that don't even ask about that, and so my point is you want to be sure that your doctor is, and I keep saying this over and over again, that your doctor is competent in what you would like for your delivery, your pregnancy and postpartum. I also wanted to say, when we were talking about the statistics earlier, when we're looking at maternal death rate, that's not just in delivery, that's postpartum. All the way through a year after delivery that we see those horrible statistics. And so to have someone that's there for you, I wish I had known about doulas when I had my babies. My mom came down, because I'm from Chicago. My mom came down for about 6 weeks, and after that, it was a wrap. I was on my own. And so certainly I have a few of my friends who are doulas. And so we talk about, and I'm able to refer them to them. And I also follow these young guys. Just started, I was following already Harmonious Birthing, and I've started following Sangika, is that right?
Yeah, you got
Okay.
it.
So I started following them on Instagram. And so my patients know that I'm connected to them and that we can develop that. Now, let me just say this though. I am not an OB-GYN. So I don't go into the hospital and deliver. But I can tell you is that most of the hospitals, at least in the Texas Medical Center, have a network, and they have that limited to the doctors that they want there. Is very institutionalized. So you have to make sure that when you say, oh, well, and I went to Baylor, but no, not to Baylor, but, oh, I want to go to Baylor. They got the best doctors. And then when you get there and they're like, yeah, okay, you're good. Okay. All right, bye.
Mm-hmm.
Yeah, so these are some things that you have to think about before you choose your doctor. And maybe you might choose your doula first and say, who are the doctors that you've seen that you trust that have good outcomes, who are open to the things that we want to do.
Excellent. I want to before we go, we got a question that came in via text, and it was asking, what is the cost of a doula? Is it covered by insurance, or is it all out of pocket?
Good question. So the doula cost varies based on the doula, because really majority of doulas are their own business, right? So they might have their costs. That depends on experience. You might see a doula prices goes up after they've had X amount of births or X amount of extra trainings. So I've seen doulas in Houston between 500 to 1,500. I think I might have seen 2,000 as well. Generally, doulas offer different packages. If they're covered by insurance, most of the time, no. But that doesn't mean you have a little loophole there, because some doulas can accept the FSA card or the HSA card. So there's benefits to bringing on a doula early. Just like Dr. Richmond said, I get really giddy if somebody comes on board with me before they find their doctor, because for the same reasons that you explained, Dr. Richmond and Jules, to ask me, like, what doctors have I worked with, or what doctors do I know that are like support you having a vaginal birth after cesarean, or unmedicated vaginal birth. But going back to the HSA and FSA, if you're in open enrollment period, like case in point for me, when I had my second baby, I found out pregnant in October, and I was like, all right, I got to put a whole lot of money in this HSA and FSA, because I know I want to spend it on things that typically are not covered by insurance. For me, it was a doula. It was chiropractic services, because my insurance was like, but and my midwife. So those are ways that you can save money, tax-free money, by putting your money into the HSA, flexible spending account, and healthcare savings account, and pay for services like doulas as well.
Yeah, the prices that Tanika said, 500, and that would be kind of like on the pretty low end too. And I've seen some 2,000, and that would probably be, just depending on the experience, and how many births they've been to, are they, like, for me, I'm a student midwife, so I may have like a little bit more knowledge on certain things. And it also could just depend on what kind of packages you choose. So like someone like me, I have different packages. Most doulas do have like a payment plan. So I have a payment plan, and you just start off with your deposit, and then you typically need to pay off by 36 weeks of pregnancy. Also, I recently just had a client who's their insurance, basically after they paid everything, they just showed their insurance that they paid, and then their insurance reimbursed them. So you can have things like that. And then also creating, I think Black people need to create more nonprofits. So I recently just got my 501, my nonprofit, literally like 2 weeks ago. So I can start getting funds for people who can't afford doulas, whether that be able, whether that would be able to cover their entire fee or maybe half their fee or just help out with what have you. So my next step is to actually, because right now I just have the Secretary of State letter. So in the state of Texas, I have the nonprofit, but I'm going to go ahead and apply for federal level so that I can basically ask for funds from all over to help birthing people, especially Black people, because that's where we're having the issue at, and that is who really, really needs doula. I mean, it's a necessity right now.
Oh, wow. Well, thank you, ladies. This has been very informative. I know that this is a conversation that definitely requires a part 2 for us to delve into more. What we'll do is be in contact with you and try to do something here before the election sometime this fall. Come back and discuss this more, looking at different legislation, what the numbers are saying, especially during this time. I would imagine giving birth right now during COVID-19 has to be super frightening. So we would love to have you all back. I thank you for joining us, and I encourage you to stay on in the studio so that you can hear our next guest. Thank you so much.
Thank you.
Thank you. Thank you for having me.
All right, Michelle. Next up, we have State Representative Sean Theory. She represents District 146. Hi, how are you?
Good afternoon, ladies. It's a pleasure to be here. Thank you so much for having me.
Oh, yes. Thank you for being able to join us. I know you have a very busy schedule.
It's been a lot. Yeah, lots going on, but this is such an important topic, so I didn't want to miss it. So I'm very, very glad to be able to talk about this. And I even have some thoughts about I listened in on the segment before with respect to doulas. So when it's appropriate, I want to share with you some policy initiatives that I plan to file next session that may be of interest.
Oh, wow. Excellent. So let's just jump right in. Portia, who's our co-host, she's in the back of the studio. She was the one who said you have to have Sean Theory. She heard you speak at I think it was the Women's March or Black Women's March a couple of years ago. And she said that your story was one that people needed to hear more of. So we would love for you to just come on in and get right to it.
Okay, thank you so much. So first, I'll just start off and kind of tell you how I was brought to this field of this body of work, and just much like the guests and the people that are listening in, this was long before I was a state legislator. This was just me being a Black woman, navigating through the healthcare system, who was pregnant and just wanted to have a healthy pregnancy and have a healthy baby. So I had a very, very negative experience in labor. I will say the process leading up to it, now that I look back, wasn't so great either, but I just wasn't in life-threatening danger at that time. But I will say, hindsight's 2020, I don't feel I was ever really treated with any real measure of compassion or care. But fast forward, I was delivering my daughter, or attempting to. I ended up getting what's called a high block epidural, which is very, very dangerous. It's when the medicine is too far up in your spine. So instead of paralyzing the lower half of your body, your legs and all that area, it starts paralyzing your heart. And so I was literally going to die. I started to notice that I was feeling something wrong when I was in the room, and I started to complain. I said, something's just not right. I can't breathe. And they were like, oh, you're okay. You're probably nervous. And I was saying, no, I'm not nervous, because I remember moments before I was laughing. I felt pretty good about it. It ended up being probably about the next 3 minutes, just the most excruciating pain I've ever experienced. And I really felt my life was passing before me. I kept thinking about my daughter. I knew I was having a little girl. And I just started making demands and saying, listen to me, I need help. You've got to do something. You've got to do something. And they didn't know what to do. And they said, my doctor wasn't in the room. They said, well, we'll have to get permission for the doctor. And they didn't know what to do. And finally, I just yelled out. I started to think about how when people say the body's in distress, that sometimes it'll protect you by fainting. I don't know why that came to my mind. And I just thought, if I could just faint or just turn my brain off, maybe my heart won't be racing like this and I won't be in such pain and something better will happen for me. So I just yelled out, please just put me under. I was having a C-section, by the way. I forgot to tell you that. That was what had been ordered, which, by the way, we'll get to that. There's far too many of those these days. So they agreed finally, and they put me under. Come to find out, when I woke up, everyone was just staring at me. I wasn't in the room anymore. And I was looking around, and everyone looked so sad and distressed. And I thought, oh, my God. And one lady was saying, I'm sorry. So I burst into tears. I thought I'd lost my baby. And then she said, no, she's fine. She's fine. I said, what do you mean? I said, are we going to go try to do it again? And she said, oh, you already had the baby. And I said, what? Where is she? And they said, she's okay. She has some jaundice, but she's okay. I'm just sorry that happened to you. But if I tell you all, I mean, I have, at the time I didn't know why that happened. And now I know, but that was the most traumatic birth experience ever. I've only had one baby. I've had my daughter later in life. I won't be having another one naturally that I can imagine. And I have no recollection of having a child.
Oh, wow.
The last thing I remember is that I was in excruciating pain. And they wouldn't let anybody come back there with me at the time because when I was getting the anesthesia. So when I woke up, I was all alone, and then they finally just kind of wheeled her in there. And I made jokes for a long time until I started to learn more about the policy work that was being done. And I realized that this was happening to a lot of different women, Black women in particular, women of color. And I used to tease and say, oh, Claire's my little Amazon baby, because I felt like I just went to sleep, woke up, and there she was, like I just ordered her or something, but I realized I did that as a defense mechanism because I was so devastated. And I was just trying to make light of something that was extremely painful to me, that I missed the entire experience. I mean, if I tell you all, I don't know anything about what childbirth is like, other than the terrible few moments before they put me under. The serendipity of it is, and this may just be God and the universe, I found out later that is the only treatment for what was happening to me, was to go under. And that is what they would have done. So I saved my own life. If I had not thought to do that, I would have had a heart attack. And I would have been one of those statistics that people would have seen, another Black woman that died in childbirth. And it would have been an error, because people would have thought that because I was over the age of 35, that maybe that's what happened. But I was perfectly healthy. It had nothing to do with my age. It was just a high block epidural. And so I never told the story for years because, like so many women, I felt embarrassed, and I knew I didn't do anything wrong, but I just felt I pushed through, and I didn't really know if I would get any empathy, sympathy, or anything. But I will say that now that I look back, I remember my doctor coming into my room later that day. I maybe had my daughter 5 hours, and he walked in and he said, hey, crazy lady. And I looked, and I was like, is he talking to me? He said, yeah, I heard you went crazy in there. And I said, you mean when I almost died? What did I do wrong? And so that played into my subconscious too, but even to speak to me in that manner. Now, you all, for everyone listening, I had full healthcare coverage, private insurance. I'm an attorney, so a lawyer. So just think, if I was spoken to that way, as a Black woman with full coverage, how are we treated? What's happening to those women that are on Medicaid? They know that they maybe don't have the education level and the access levels that I have, but it didn't really help me because I ended up just like anyone else. We know, so it happens to Sean Theory, it happens to Serena Williams, and it'll happen to the next woman. Her name is Shannon Williams, whoever, sitting in the waiting room. So when I just by happen chance later on ended up in politics and became a state legislator, something came across my desk one day, and it was a report. It was from the Maternal Mortality Morbidity Task Force. I had never heard what that was. I'm a nerd, so I sat there and I read it. And as I was going through and I started to look at the alarming rates of women who were dying in childbirth or within 1 year, as Dr. Richmond mentioned earlier, something that stuck out to me was the number of Black women that were dying. And everyone was silent about that part. No one was talking about that. And so that's when I started to file legislation to look into that and say, well, wait a minute, if this is the group that's dying at the highest rate, why isn't anything being done to address this or understand it? And then that's when everything took off and my journey started. And I started getting calls from national news outlets. Europe, the BBC came and watched the bill lay out when I laid out the bill for Black women, because it was something that had not been discussed. And so I've continued to try to move the ball down the field. We did get the initial legislation passed the first session after getting killed several different times. It ended up passing in a special session with bipartisan support. Everybody came completely full circle. Everyone that was against it ended up being for it. So we were glad for that. But there's so much more work to be done. I have a number of other bills that I'd like to get passed. I'm trying to get Medicaid coverage, extended for 12 months, postpartum. We still don't have that. We want doula coverage. We were talking about that in the segment before. I plan to file legislation so that Medicaid will cover expenses and doula visits. So I'll pause there and I'm open for questions. We want to also, let me look at one more thing. We want to address the role of racism, systemic structural racism, as it relates to Black women in healthcare. So implicit bias, we now know from the work group and the studies that we've done, is playing a part. A lack of cultural competency. So last session, I filed House Bill 719, which will require implicit bias training, cultural competency training in medical schools and as a condition of relicensure for anybody in the medical profession. So that's a bold, big bill, but I'm going to ask you all to support that next session, and we're going to continue to push for that because I see it as a matter of ethics. And as lawyers, we have to have continuing education credits for ethics. And so I think that this is an ethical consideration that needs to be required in the medical profession.
Oh, wow. I'm still stuck on the way that
Are you still stuck on someone walking in and that's the first thing I hear from my doctor?
That's the importance of the village. Even more. I mean, reason to have that circle there.
It's painful for me to think about it now because I'm wondering how did I just allow that and ignore that? And that's not my personality, I will tell you. So just like so many of us, I think I was bullied into submission on some level because I know I needed the help. And I, just like most Black women, I didn't want to be labeled an angry Black woman or something. But, of course, like they say, I wanted to start moving some furniture around there, but I was too sore. I have a C-section. I can barely move. But I mean, that's so offensive. And my mom, who would have there been and helped me, had actually gotten ill. And then my father ended up being admitted to the hospital. So I was on the 7th floor. My father was on the 9th floor. My mother got admitted into the ER throughout that whole process. She got so stressed out. It was a very traumatic time for me. And then to know that my OBGYN would be that dismissive and that rude and that mean to me and that angry at me for their error. And I will tell you, there was no follow-up. We talk about that in some of the policy work. I want to file something that's called 036912, where you start your prenatal care, which is from 0 to 3, 3 to 6 months, 9 months. But what about the 12th month, 3 months after care? that's when we see that women really start to go down, whether it's postpartum or being released too early and becoming sick from an infection or something else. No one ever called me again. My doctor never called, ever asked if I lived after that or not. I never went back for a checkup.
Oh, wow. Everyone is the background freaking out.
Yeah, I just started taking my baby to the doctor all the time. But as a mom, I was tired. I had the C-section, so I wasn't supposed to drive for 6 weeks. But I got her to her doctor's appointments. And then here, I mean, it's a safe space to speak. I know other people are listening, but that was an error on my part. I'm an educated woman, and I didn't have that support. And I had it from my family, but I think the way that I was treated in that system, I was not excited about going back. And I had such a bad experience with my doctor, I didn't even go find another one. So I had to have been a year at least before I went back to the doctor.
Wow. I'm going to bring in Dr. Richmond and Deshawn both. So we'll get a doula and the MD in here. And I'm going to see if we can make this screen bigger. Does that help? Yeah, that helps a little bit. I know y'all are in the background hearing. Can we call you Sean?
Yes, ma'am. Yeah, I'm like, yes, ma'am. Yes, sure. Yeah. Sure. Go ahead.
Listening to Sean tell her story and giving her experience, like what's going through your minds? I saw your comments. I saw the doctor just waving in regards to that last bit. So what were y'all thinking as you're hearing this?
Well, I'm thinking that this is a very traumatic experience, and other people listening may feel like, oh, wow, that's such a terrible thing. That can't happen all the time. No, this happens all the time. This happens to Black women all the time. People don't realize that Black women literally are walking around with PTSD because of their birth. So let's first get into the cesarean rate. I think Michelle was talking about cesareans earlier in the segment. The U.S. is cesarean rate is 31.9%, and it should not be that high. First of all, and then what Sean went through an emergency cesarean. I think at first he said it was scheduled, Sean.
No, I went in, my water broke a little early. I was about 8.5 months pregnant. So I didn't really dilate enough. And they said that my pelvic bones were a little close together. They misdiagnosed her size. They said she was 8 pounds. Of course, she was 6-point-something pounds because she hadn't even really cooked fully. So the doctor just told me that I would need a C-section that day, that I wasn't going to be able to push her out. So I said, okay. And so then they scheduled it.
Right. This is all stuff that
I wasn't sick or anything leading up to that.
Right. This is all stuff that happens, when I say on a regular basis for Black women, especially with the misdiagnosis of, oh, your baby's too big, or, oh, your hips are too small, you can't push out this baby, let's just do cesarean. It happens all the time. I'm pretty sure Dr. Richmond can kind of piggyback off of that as well, but this is a common thing, and it should not happen.
I want to apologize. I've never even shared the full story with my colleague, my friend, Dr. Richmond. You probably have, maybe, like you said, seen me speak about it a little bit, but I agree with you. It is, I guess I am still traumatized by it. I'm feeling kind of numb right now. I'm not going to cry, but I feel really numb.
So I'm over here like cracking my knuckles. I know it happens. Okay. So the whole situation, I want to honor you for being open and sharing with us in such a vulnerable way. So thank you so much. We've been around each other before, and I didn't know this. And so I support you. I appreciate you for sharing, because I know that was hard. I know that was hard. But I also, sorry, y'all, this pisses me off.
Right.
Because we work so hard. We get the best insurance. We do, we get educated. We do all of these things. And at the end of the day, we're just Black, right? And so I had a similar experience where, and the doctor knew I was a doctor, where my placenta totally covered my cervix. So I had complete placenta previa, and I knew that I was going to have a C-section. So the doctor, the specialist who was doing my ultrasound was like, he was the old white man. He was like, well, since they're already going in, you might as well get a cis-his. Excuse me? Like, who says that to a 39-week pregnant lady with no one around? Like, really? And I did complain with him, but he is a well-renowned, blah, blah, blah doctor. So one of the things that I did want to say is we got to speak up. We have to speak up. Complain. Let people know what's going on. I think sometimes because of how we feel, and there's some level of shame, like we did something wrong. We didn't do anything wrong. Sean, you didn't do anything wrong at all. You advocated for yourself. And for him to say, baby, listen, I'm talking about really.
And you know, one thing I'm having some flashbacks, some more memories. What also happened to me, another horrible part, like I said, I have no positive experience of having the baby. I don't remember that. But when I went to get my ultrasound to find out if I was having a boy or a girl, he crapped all over that too, because I remember he clicked on the screen and I was looking and he said, you want to see the baby? Really fast. I was like, of course you can. So he did something and he said, here's the head, here's the shoulders. He said something like stomach, legs. No, he said legs, nothing in between, buy something pink. And he turned the screen off. And I said, wait, what? And he said, head, shoulders, here's the legs, nothing in between. It's a girl, buy something pink. And he clicked it off again. And I was like, oh, like I was like, what? I guess, yay. What, it didn't quite need to go like this, did it? Like I'm wanted a girl, but I mean, just head, shoulders, nothing in between. Like saying there's no penis. And but he would turn the screen off. He just kept clicking it off so fast and said, go buy something pink. And it was like, get up, it's it. And that was it. Like I got up and that was the end of that. That was it. That's how I found out I was having a girl. And just like you said, Dr. This is a prestigious practice. I've never identified who the doctor was. But this was in the medical center, a big, big practice. That was another mistake, going to such a large practice. I remember when I first went in there were women everywhere. I mean, it was packed, it was just, and the wait was always long. So the only difference between that and being in a free clinic is that it was on the 50-something floor probably of a building, or the 30-something floor of a fancy building. But the quality of care was no different than what you would expect if they were understaffed or you were in an underserved community. It was worse because there was no compassion, there was no care.
That's not even just not having compassion. That's just pure insensitive, insensitive.
I almost felt like from competing with me a lot of times for intelligence. I felt that it was the level of racism I was experiencing was that sometimes when people have a stereotype against us and we don't fit the paradigm, the stereotype they want us to fit, that they get angry. So he's like, oh, look at her over there all educated. Put her in her place. Yeah,
Yeah.
We know that feeling.
Yeah, using some big words or whatever. So I felt like he sometimes was going out of his way to let me, in a very, like doing these microaggressions, to let me know that I'm not better than him. And I know that you think you are. It was just, I felt this combativeness and competition to where, I didn't fit what he wanted. I wasn't on Medicaid. Now, mind you, he wouldn't have been any nicer, though, had I fit that stereotype. Then he would have been telling that woman, probably saying, you don't even need a baby.
Mm-hmm.
Why do you have another baby? You're only this. Well, who's going to take care of this baby? I've heard my constituents tell me doctors have said things like that. So I think, tell them, like, if you're having your third baby, are you really having another baby? And that's too late to tell somebody that when they're in delivery. There's no point in saying something like that to someone, So yeah, chastising them and reprimanding them for being pregnant again, and they're already having the baby, so just over-inserting themselves. And so I think that's something we have to talk about as Black women, is that for those of us that don't fit the stereotype that they have tried to make us fit, there's punishment on that end too. And so, because I've talked to different people about racism, and they'll say, well, if only y'all this or that. I said, no, you're going to experience racism no matter where you are in the echelon of the hierarchy that they've laid us out. I mean, like you said, you could be Serena Williams, you can be Beyonce, you can be Dr. Richmond, you can be State Representative Theory, or, you know, you can be whomever at waiting in line to get a wig cart. We're all going to, at some point, experience something.
Okay. Real quick, I know it's almost 6, but we're going to keep going. So if anybody is watching, y'all got somewhere to go, y'all go, but we're going to keep going because this is too important. And I can stay as long as y'all want to stay. So let me just say thank you for the transparency, for the honest, for being pissed off, Dr. Richmond, you know, and expressing that. I know Sanika, say it again. Sanika wants to speak real quick, so I'm gonna go to her, and then I want to share an experience from 2 weeks ago that I had.
Okay, thank you. So, State Representative Sean, you talked about how you would go to the doctor and be like in the waiting room for an hour, and then with him for like maybe 5 to 15 minutes. With my first child, I started going off. I had an unexpected pregnancy. I didn't realize I was pregnant until I was 13 weeks, and I was like, doctor. So go to a doctor. First, I had trouble finding a doctor that would take me because they would be booked until I was almost 20 weeks. And I had trouble finding a doctor that would take me past 20 weeks. I had that issue, found a doctor, and then I would be same thing in the waiting room. You're in the waiting room for an hour and you speak to them for 5 to 15 minutes. And oftentimes you feel rushed. And I don't know why we do this, but we feel bad for having so many questions, but we are experiencing something new, and we want to make sure that everything is okay. So, rewind to when, before I got to a doctor, before I even knew I was pregnant, I knew I wanted a midwife, but the unplanned pregnancy and the unexpected pregnancy threw me off guard, and I went straight to like doctor mode, right? Because I wanted to make sure everything was okay with the baby. But then I kind of reminded myself, saying, what do you want? What is the type of birth that you really want? So I switched care at like 25 weeks from a doctor to a midwife. And it went from being in the waiting room for an hour to being in the waiting room maybe 5 minutes, and being in with the midwives for an hour. And oftentimes when I'm talking to a potential client or even someone that's already signed on to me, low-risk mothers, low-risk birthing people are ideal clients for midwives. And yet I often get pushback from my clients that is like, I want to be somewhere that they're safe. But the reality is the midwives have your back so much more. They're there with you throughout the process so much more. You get to know them personally. It's almost like, and even for that hour, you're more so talking to them than them checking on you. The last usually 15 minutes is like when they start palpating baby and everything. It is an amazing experience, one that everybody, if they so desire, deserves to see the difference. And what the good thing about, if there is anything about COVID, is that it is really turning people's lights on to have midwives. Midwives are booked and busy. They're a waiting list. Like as soon as people find out they're pregnant, like what are we talking, 6, 8 weeks? If you're interested in having a midwife, reach out to them because they are very, very much busy. And I'm happy for that, because the type of care that you'll get in the midwife setting more often than not is unprecedented to a hospital setting. So that's my 2 cents.
So a couple of weeks ago, I after open enrollment ended for my job, I reached out to my primary care physician. Just wanted to talk to him about travel, COVID-19, just some best practices around this. But I also wanted a referral to OBGYN because I'm with a new clinic, right? And I chose this doctor as my primary care physician, one, because he's a Black man and he was a new doctor. So that means he was building his clientele. So I knew I could be like his patient. And so our first meeting over a year ago, I explained to him what my expectations were. I let him know, like, look, these are the things that I believe in, blah, blah, blah. But when I wanted to make that appointment with him for the referral, the person who took the call was, and I told him, I said, I want a referral, and I want a referral to a Black OBGYN within your system. They responded, just go to our website. We have highly qualified doctors. And I'm like, see, you're not listening to me.
Mhm.
So what I did was I called back, knowing I would get another operator. And I asked for an appointment with my doctor, and I did it virtually. And he listened, but that's because I've already established that relationship. So in that regard, and as he listened, he recommended two people based on the things that I was saying to him.
Mhm.
I think that's something that we don't take enough time doing when we choose doctors. I've been in the hair salon and someone will say, well, I go to such and such. And we take that as the reason why we go to that doctor instead of interviewing them, and really getting an understanding. I think your physician needs to be someone who you're comfortable with, someone that y'all don't have to be besties, but there's got to be some type of relationship, some rapport, some respect. And I told him, like, my OBGYN for years would whistle. It's so funny. This doctor, he would whistle while he's doing your checkup. And I once asked him, I said, hey, doctor, if you start whistling, do I have something to worry about? He was like, nah, I'm probably just out of breath, right? But we had built a relationship, even to when I left to go to law school, I could come home unassured. And he would see me because I was his patient. And I think that's what happens a lot of times is we don't become that person's patient, And back to that authority thing that Dr. Richmond and I talked about, there's a respecting in our community. If someone's in a position that a lot of people perceive as a position of power or influence, we just listen to what they say and we won't fight back and say, but no, that's not what's happening. Like Sean listened to the Holy Spirit, because I believe that was the Holy Spirit that told you to act in the way that you did. Say you believe that voice in your head. I think we have to do that more. We have to be more discerning in our spirits and just ask the question and kind of fight back with our words. If that causes them to think we're the angry Black woman, well, they don't need to be our position anyway. Yeah.
I never even, I'm sure the doulas and midwives can relate to this. I had all the little books on the birthing plans, and I had all this cute little stuff of how I wanted it to go in the room and the music and the whole way I thought it was going to look. And obviously that did not happen. But to be honest, that was never asked of me. I never could find the ideal time to tell my doctor about that when I would go to see him. So I started saying, like they say, where they do that at? Like, where do you get these? You read it in what to expect, when you're expecting. And so I started to say, this is silly. There is no such thing as telling your doctor you want to hear this and this song played when you have the baby. Because I was like, there was just no way that would have happened for me, even if they had not have to put me under and have the most traumatic experience. I just gave up on it because I realized the environment was not conducive to that. That was not the kind of relationship I was having with the physician that I would not be the kind of patient he would do that for. And so then I started saying, well, this must be an outdated book, because I don't think that they do birthing.
I think that also boils down to, okay, of course we have lack of cultural competency, we have implicit and explicit bias, and we have those providers that don't necessarily care about Black women or Black birthing people and the outcomes. But it's also sometimes like we settle, or we think, a lot of Black people may think, yeah, the hospital is the safest thing for me because if this and this happens and they can save me or what have you. Well, on the flip side, midwives and doulas, we do a lot of preventative measures, from knowing what's going on in your life, because we know that social economics and things of that nature affect everything. And I'm talking about if we as Black people are faced with something, like a racial disparity or just anything racist in general, even, the protests and what led to the recent protests, stuff like that. Do you guys understand that messes with our cortisol levels, which thus messes with our blood pressure? It thus affects our pregnancy, thus leads to premature birth and low birth weight babies, which is why babies that are born to Black mothers have a 3 times more, are 3 times likely to die than white babies. All of these things play a factor. And then you have, we have diet, we have herbs, we have natural modalities, and we have looking into your blood work and talking to you with your blood work. You know how many people I have come to me and they're severely anemic and they don't even know. I'll say, hey, did your doctor do your blood work? Oh yeah, I have it right here on my phone. Let me show you the thing. So you mean they just sent to you, they didn't say nothing to you about it? You understand what I'm saying? That's a midwife's not gonna do that to you. They're gonna sit down and say, hey, this is this and we need to fix that now. Not, oh well, if you're anemic, it's okay. If you need blood, we'll just do a transfusion. It doesn't really matter. We got extra blood in the bag.
Well, wait a minute. I don't do that.
No, I'm not saying I'm saying providers
so
with implicit and explicit bias or don't really care that much for our Medicaid mothers or our Black mothers. That's what I mean. I'm not saying all providers. I'm just saying, but this happens a lot.
It does.
Mm-hmm.
It does. And I have patients who leave other providers and doctors who come to me and they say, oh yeah, I had my blood work. Everything was fine. I'm fine. And then I said, well, I would like to do my own so I can see, especially if I don't have their medical records. And you're right. A lot of times they don't know things like you said, anemic. They don't know they have low vitamin D. Sometimes they don't know that they have an abnormal pap smear. They just know, the doctor said come back in 6 months, but they don't know what that really means because the conversations are not being had. And I would say this is one of the reasons why I went into private practice, because I got tired of being in the rat race. And, from a provider side, they literally bring us into, when you work for a large institution or hospital, they literally bring us into rooms and say, Dr. Richmond, your turnaround time for each patient is 30 minutes. You need to cut that down to 15 minutes. Dr. Richmond, you're not generating enough income. And some doctors actually, depending on where they work, they will take some of your income away or you have to pay back if you don't get to a certain level. So there's a lot of pressures that come to the doctors as well. And particularly if you're a Black doctor and just thinking about and talking about implicit bias, and we go through a lot too. It takes a lot to get to where we are because we're facing that as well. So I may have to argue with a specialist and say, oh, no. Wait, what? You're not going to do what? Why? You're not going to do a stress test. Why? The lady is complaining of chest pain or she's complaining of stomach pain. And we know and I don't want to go all the way off the subject, but we know that women present differently with heart problems, Black women with heart problems. So don't dismiss her. I don't need for you to do that stress test. But again, that goes back to who you choose to take care of you. And if they are on their first visit, if you don't get a good vibe, most likely you're right. Or if you call and they're not nice on the phone, you already know the experience. And the doctor in that office is allowing that to happen. So just really, really thinking about that. And with Medicaid, I know a lot of women feel like they don't have a lot of choices, but you actually do. You actually do have choices. And so I think it's more very much about empowerment for us so that we know we have a right to choose, that you have a right to offer to say you want this birthing plan, that I had a right to say, I don't want no C-section, hysterectomy. I told my doctor, I don't want no hysterectomy. And she honored that because of the type of doctor she is. But some doctors would have been like, it was too much, you bled too much, we just had to take it all out. Right. But it really, really depends on who you choose.
And by the way, in Texas, if you do have Medicaid, there is a Medicaid birth center here in Texas, North Houston Birth Center. So remember that if you have a low, if you have a low risk pregnancy, you can check them out. If you have Medicaid, that means you don't have to pay for that birth center whatsoever. And then, Dr. Richmond, can you share the statistic that you shared earlier about the survey with 50% of people?
Oh yeah.
Can you share that stat again?
Yes, and I remember when Rep. Shawn said that she was going to fight for. I remember when she came up with the idea, and she was going to fight for her
Medicaid
for the medical students and residents to get cultural competency training.
Oh, right. Mm-hmm.
And so that study showed that medical students and residents in training, over 50% of them thought that Black people don't experience pain.
Mm-hmm.
They thought we have thicker skin, and they actually put this down. Like, can you
Yes.
believe it? Like, who would even? I would be like, I'm not like really. That we have thicker skin.
But not the cliche, like, oh, you got thick skin, you can handle it. Like Dr.
Right.
Richard said, physically thicker skin, which also Dr. Richmond, they've said, has increased sometimes to them actually poking harder with needles because if the skin is thicker, and then if they think we have a higher pain threshold, they said from being slaves, that our wait time in ERs is much longer when you look at the data. So dispelling our is going to be very important.
That our nerve endings are not as sensitive as our white counterparts.
Mm-hmm.
Really?
And that originates from who we call, or who America calls, because I don't call him nothing, but America calls him the father of gynecology.
Oh, Dr. Sims.
Yeah, this man, what he did was he took enslaved Black women. I'm not going to say slaves because we're not slaves. We were enslaved. We were enslaved Black women, and he would perform procedures on them and do all kinds of tests on them with absolutely no anesthesia. I'm talking about cesareans. Doing just astronomical things with these Black bodies with no kinds of pain, nothing, no pain medication whatsoever. And so he would practice on enslaved women, enslaved Black women, and then he would then go to Europe and go work with wealthy white women, and of course would put them under anesthesia. So there was this whole ideal that they can take it and they don't feel pain. It's just they're Black, and clearly based off of that statistic, it's still true. People still feel like that is true, and these things are documented in textbooks.
Mm-hmm. Well, I hope you all. Next session is going to be a different looking session because of COVID. So there will be some limitations. We're still trying to figure out what it's going to look like with how we're going to get bills before committee and how people can testify. But I'm going to put out a new one pager. This was the one last session with the bills that I was filing for improving maternal health. And so I will revise this, update it, and I'm just going to ask all of you, your members, everyone listening, followers, to stay engaged and to help me with that. You can register and testify. Dr. Richmond, you'd be a wonderful witness to come in and testify for a bill. But we want to make sure that we have our voices and we use the power of our platforms on social media and everywhere else to get as many women possible on board to support this. Because as a policymaker now, it's the only way I can effectuate the change on this side.
Oh, wow. This has been so powerful, ladies. Like, I'm full. My mom came peeking in the door and I'm like, go away, you're loud. But this is such a great conversation. And it's not just for people who live in the Houston area. This is a universal issue in this country, I should say. This is a national issue where Black women are not being heard and where we're dying at alarming rates compared to other races when it comes to childbirth or even after childbirth. So I, again, just want to thank you all for joining us today. I want to thank Nichelle for having the vision for this show. Mm-hmm. That's our baby. Good job, she joined our committee this spring and she was very excited to produce this episode. And I just want to thank you again, Nichelle, for your vision. And each of you ladies, thank you for the work that you do in your individual capacities and collectively. And I look forward to having you all join us again right here on CommuniTEA, hosted by your Houston NAACP branch. Thank you so very much.
Thank you, sisters.
Thank you.
Bye.
Bye.
Before y'all go, hold on, don't go.
Okay.
Tell people where they can follow you.
Oh, okay. You want to go first, Dr. Richmond?
Oh, thank you, Sean. So you can follow me on Instagram at Dr. T. Richmond _MD, and then on Facebook, LinkedIn as Teriya, TERIYA, Richmond MD MPH. Oh, and if you need to make an appointment, I'm sorry, my number is 832-215-5985. And I definitely want the doulas to come and visit me. Please come and visit me.
We
Please.
are coming.
Yeah,
Okay.
we can probably
All right.
come
I'm
together
excited.
and you could.
Yes.
Yeah.
Road trip. Mini road trip.
And then you guys can follow me on Instagram at Harmonious Birthing, just how you see it on the screen. And on Facebook, I'm Harmonious Birthing 2, like the number 2. My website, where I have my doula information as well as other health and wellness products and my books, is www.holisticbirthandhealth.com. And yeah, that's it.
And you can follow me at Senyika the Doula with dots in between, so it doesn't look like one long sentence, on Instagram and Facebook, and www.senyikathedoula.com. But if you go to the Instagram page, link in bio will send you to all those places as well.
Okay, and you all can follow me. We will start with Instagram at Rep Theory 146. I represent the 146 district, so it's easy to remember, Rep Theory 146. And then on Facebook, you can just type in Sean Theory. My personal page and my state representative Sean Theory page are both usually public. That's pretty much the platform I use a lot at Facebook because my constituents use it a lot. And then on Twitter, I'm Rep Theory 146. Anytime, reach out.
All right. Well, we thank you for joining us and look forward to having you back here again. You all have a wonderful evening and a great rest of your week.
Thank you.
Thank you.
Good night.
Have a good night,
ladies. All right, Nichelle, congratulations on your first show. That was awesome. We have Portia rejoining us. All right.
And that was awesome. Great job, Nichelle.
That was great. I feel so like, I don't know, like uplifted and like ready to fight, like girl power, you know, Black girl magic, all of that.
Black girl magic all the way, yes.
That was really very, very needed. The village, the whole concept of the village. And now I'm like seeing scenes from Black is King, you know, just that whole idea of it. Everybody being involved. That was just wonderful. Go ahead.
I think it was an important conversation to have now as well, because I know we all have seen, I have gone to so many baby showers, like virtual baby showers, and it's so many, like, I'm not saying this to be funny, but it's a lot of COVID pregnancies. So a lot of people have, you know, decided this is the perfect time to have a baby during this time of us, you know, being quarantined and being in the house. So I think this is definitely timely, because like literally I've gone to like 7 or 8, you know, virtual baby showers. And I know, you know, it's some more coming down the pipeline as well. So this is really great information. I thought about tagging a couple of my friends in this post, but I'm gonna make sure that I share it with them, you know, for my ones that I know that are, you know, newly pregnant. So let them know their options as they, you know, continue on their pregnancy. If they have the means, of course, to be able to look into a doula or a midwife. This was definitely needed.
All righty. Well, until next week, everyone, we thank you for joining us here on CommuniTEA. We'll be back next week. We'll be back next week. We have 3 more shows on Wednesdays, and then we're going to make a special announcement about how we'll be moving forward with the show. But we will be moving forward with the show. But we just want to thank you all for tuning in this week, and we'll see you later. Bye.
Bye, guys.